Welcome, everybody. We are just letting some folks in, and we will start in just 1 minute. Thank you for joining us this morning. My name is Owen Hutchinson. Today, we're going to hear from Meg Zalatel, the Executive Director of the Anchorage Coalition to End Homelessness, and Taria Ware, the Systems Improvement Administrator, and possibly Don Allen Heron from St. Mary's Episcopal Church. After that, we will take questions from the press. But if any member of the public or another agency has questions about our update, please email me directly. My email is on the invite, and I will put it in the chat. And I will follow up with you later today or this week.
All right, good morning, everyone. I'm Meg Zalatel. I'm the Executive Director of the Anchorage Coalition to End Homelessness. We've called this press conference today. We usually would have provided this community update to the Assembly's Committee on Housing and Homelessness, but that meeting was canceled. We think that given 15 days until the closure of the Sullivan Arena, it's really important to get information out into the community so that the community is on the same page about what's happening with the homeless prevention response system in the lead up to the closure of the Sullivan Arena. So with that, we're going to provide what would be our typical update plus some more context in this time, this crunch time in the last 2 weeks. So I'm going to start by overviewing some key indicators of the homeless prevention response system. This is to give you a snapshot of what the system looks like right now. So currently, there are 219 Sullivan Arena individuals in the Sullivan Arena, according to the municipality's dashboard this morning, and there are 191 occupants at non-congregate mass care, again, according to the municipality's dashboard. There appear to be 58 non-congregate units open, and we have the expectation that those will be renewed for 90 days starting July 1. We do realize it is pending an appropriation for the funds, but we are remaining optimistic that that will happen. So that would give us the opportunity to fill those vacancies with approximately 55 people that have been identified from mass care. And we do have a challenge, however. We have 2 challenges with that. One is there are some staffing constraints at that facility that limit full capacity. So approximately 44 of those people that have been identified could move into the non-congregate facility. And the other challenge is we need transportation. It is a lot to move from one location to the other because it's not just the individual, it's also their belongings. The other, I think, key indicator we really should talk about is that Brother Francis, the established non-barrier shelter in our community, is open. It is open back up after closing for about a week and a half to do some cleaning and deferred maintenance, but it's already at capacity. Similarly, the complex care facility is open, and it will be at capacity by the end of June with folks who have already been identified that will be exiting mass care. They have to go through the referral process to get into that facility. There is a little bit of capacity in the system. It mainly resides in a high barrier program that is for men with 30 beds. I believe it has both a sobriety and a religious component. Most of our housing programs are full with wait lists right now. And additional housing capacity, particularly finding independent units, has been delayed because we have had delays with rental assistance from the municipality. We're waiting to activate about $900,000 within the HPRS to get people housed. And then a new development as of yesterday is that 42 camps or encampments were posted for abatement, and notice was received to our outreach team on 6/14 from APD. So that's the current lay of the land. Next, I want to address the demobilization situation reports that are being put out by the municipality, because this is the approach that we understand the municipality is taking to effectuate the closure of the Sullivan. However, some of this information we believe needs additional context, because we think it's really important to understand how this plan operates within the homeless prevention response system, because the individuals we are addressing are experiencing homelessness. So first, it's really important to acknowledge that this demobilization plan is not developed and hasn't been coordinated with the homeless prevention response system. We are not asked to give information or specific feedback about the demobilization plan or the situation reports before they come out. To the best of our knowledge, the homeless prevention response system, the coalition or others aren't involved in the incident command structure from like a FEMA response that would be informing these actions. Additionally, as I mentioned previously, the reopening of Brother Francis shelters already occurred. It's full. So any capacity mentioned in these reports isn't new capacity and can't be counted on to bring down the census from the Sullivan Arena as it stands on the date that these reports are issued. We really want to be clear about what case management is. I think case management, it's a key to unlocking a lot of services in our community and accessing those services, but it's a process. In and of itself, it is not a solution. And as we've talked about throughout this housing surge and the working on, our work in demobilizing mass care, case management capacity continues to be a community challenge. And there have been no additional resources offered to expand capacity. I think it's really important to acknowledge that service providers and case managers have been doing a lot more with less, and they are stretched to the max. And so just simply saying that case management should be offered, we need to find the availability of the case management, ensuring that it's well resourced, and that there's that opportunity for case managers to develop relationships with the people they're going to be assisting. Again, it's a process. Also, with regard to case management, someone choosing to camp that is not mutually exclusive of case management. Individuals can be involved with case management and on a pathway to housing, hooked in with services through case management, and experiencing unsheltered homelessness. Just because you have case management doesn't mean you couldn't be unsheltered, and just because you're unsheltered doesn't preclude you from accessing case management services. So we want to be very clear about that. There was a resource guide link provided in this last situation report. And that resource guide, it's nice to know that all of the resources kind of within the community are compiled in one location. However, for utility for an individual experiencing homelessness who is facing a deadline for the end of their shelter, we think this resource guide could be further refined. We're happy to work with the municipality to do so, because most of those resources provided are already at capacity, as we've indicated, and have high barriers. And they're not necessarily resources targeted to meet the immediate needs of people experiencing homelessness. If you chat with folks who are experiencing homelessness about their real concerns about the Sullivan Arena closing, it's the access to food, a safe place to be, water, hygiene facilities. I mean, these are basic immediate needs. And that's really where we need to concentrate on providing information for folks as they're likely to lose their shelter at the end of the month. We wanted to clarify that coordinated entry services have been available at the Sullivan Arena, both at the event that recently happened, and they remain available on demand through various access points. Those access points are available on the coalition's website. Case managers have them, service providers have them. It is something that is coordinated entry is something that can be accessed relatively quickly and done actually in a pretty quick manner. So it isn't something that we have to stand up at a particular place at a particular time. It is something that is available through the telephone, frankly. The Aviator Sea Wing, we've been getting some questions about this, about like, what is this? And these are private units available for lease. And all of the clients who are going to be leasing those units as rental assistance becomes available and that process is completed have already been identified. So this is, again, not new capacity within our system. One of the real concerns we have is that there's no alternative shelter identified in the situation report that's going to be stood up temporarily in that time between the closure of the Sullivan Arena and the proposed, the navigation center, low barrier shelter coming online. So we don't know what that transition looks like for individuals other than they will have to go into the community unsheltered. And the reason that's concerning is because we know that's going to be a number of months. We also know that the non-congregate mass care site that remains is by referral only. It's not, someone can't just walk up to that location and get in. And we fully expect that capacity to be full as, well. So we really need a place to be able to tell people where to go. Our outreach teams are out in the community and we really need clarity. Is there going to be anywhere else for people who are experiencing homelessness to go? And in addition, as people come into the system, and we'll talk about that a little bit more later, what do we tell them? Where can they go? Where can they go for help? Because right now the system is full. And so is anything else going to be stood up? And we really put that to the municipality. Do they have the resources? Do they have the intention? Are they making the policy decision to put something in place until the Lowberry Shelter and Navigation Center come online in the future? And then that really gets to this last bullet point, which is the municipality at this point has been directing us to take all of our needs requests to the assembly. So I am hopeful that there are some assembly members listening. We will also be sharing this with them to really have the conversation, make those decisions about food, hygiene, transportation needs, and is there going to be a temporary interim location stood up so we have a place for people to go? Because right now we are having to tell people over and over that there is no capacity and nowhere for them to go. So with that, I think we can move on to the next slide. Taria, do you want to discuss the housing successes to date?
Yes, wonderful. So if you haven't heard the reports for the Homelessness and Housing Committee, we do report monthly on the Housing Surge and Shelter Stabilization Initiative, where we focus on individuals over the age of 25 with no children in physical custody. So the last number in this box were total adults over the age of 25 who secured housing, and that number was 60. I do want to say at this time, though, when you hear our report next month, the numbers for March, April, and May will change, and they will be a positive change. There are some agencies that have not been utilizing HMIS, and we were not able to get their numbers at this time, but they have promised to give those numbers of those that they have housed in those months. So we are expecting to see an increase in those numbers when we give our next report next month. I'm going to go to the next slide. From July 1st to 2021 to May 31st of 2022, 327 plus single adults have been housed. I put the plus there to indicate, of course, those missing housing numbers that I just talked about. So that is a significant amount of people. And when we talk about being housed, As Meg talked about case management, this does not happen in a day. This is not an hour. This is a relationship that is built over time to understand and assess the needs of those persons experiencing homelessness and where they can go in our community, where they're most successful, and then building those supports. So these 327 single adults have been engaging in that process for, it could be weeks, it could be months before they're housed. It could be even longer. So just wanted to give the realistic expectation of what it takes to truly house someone, and then keep those supports in place to keep them housed so they don't come back into our system, which we will talk about in our next slide. This is my last slide, and normally I love to end on a positive note. I will say that it is hard to end on positive notes as of late. And so this is a very hard slide to give at this point. And the first one talks about our inflow is about 300 to 335 individuals into the system each month. Now, this is not just single adults. This includes families. So, which is even harder to see, as I know many of you have heard of families sleeping in their cars, families having nowhere else to go but a tent or anywhere else because the shelters are full. There is no capacity for families at this time. Access to funding for housing individuals without a program attachment or case management. We have asked and put forward plans to the municipality, and those funds just have not been released. For example, the $900,000 that the ITB went out, that $900,000 could have housed 40 units. And so we are still waiting to deploy those funds so that way we can house. And 40 units isn't 40 people. 40 units could be, 80 people. It could be whatever that is. It's the composition of the household. So just recognizing that 900,000 is a year worth of assistance. The next one is experiencing unsheltered families for the first time in many years. We are seeing a realistic uptick in family unsheltered homelessness. It is coming out in numerous areas, and there is no capacity to house them. So that was one of the questions that we'll get to later for policy questions. Transportation for individuals. Our executive director, Meg, kind of spoke on this earlier, but it is not just taking those and transporting them from one area to the other. The next, it's not here, it was there. But anyhow, I will just say that it is also, when we're talking about housing someone, they have to view the unit first. They need to see the unit. And then once they see the unit, they have to do an application. They might have to go get a money order. Then when they move in, they have belongings that they need to move in. So it's not as simple as, let's get them a cab or an Uber or a Lyft if that agency or entity will pick them up. Because a lot of times we call on those services and they do not pick them up. So at one point, the municipality did have a contract for non-critical transport, which was vital in our HPRS, and it ended on March 31st. To move those individuals, especially when we're talking about moving into housing, but to move them, period, so we can get them the supports and the services that they need. Then, of course, locating individuals. As we are seeing no intakes available into the Sullivan, and then also having, individuals leave the Sullivan for various reasons, then looking at where are they? How can we find them? And it brings us back to what also was spoken about before, camp abatements. When you are abating camps, you are moving those folks, and then we lose them all over again. Therefore, it is harder to engage each and every time. And that means it's harder to get them connected to services, which also means it's harder to get them housed. Of course, we continue to see in our community the availability and accessibility of affordable rental units being an issue. And then the inaccurate, incomplete, and untimely communication on the MOA plans regarding the closures of facilities and camp abatements. We have sent numerous correspondence to try to get this information. Even when, Meg was on her hiatus, we sent correspondence asking to be a part or to know the transition plan, and that information has not still been given to us so we can disseminate that, or so we can even look to see how we can make a plan for our HPRS that best serves those experiencing homelessness, because those, our neighbors, are the ones that we are truly trying to reach these services and these answers for. And then, of course, the unresolved MOA policy decisions that affect the HPRS and homeless response activities. There were recently, ACH did put out those 5 questions. Not sure, Meg, if you want me to go over those 5 questions or if you just want to leave that as it is.
Actually, that's a great opportunity.
Okay, wonderful. So the policy questions that we asked were, are camps still being abated? If so, what shelter space is being used to justify abatement? Number 2, will the municipality provide food and water to those unsheltered? If so, how and who will pay for it and when? Of course, ACH can coordinate outreach and case management teams to coincide with the distribution points and schedules. Are hygiene facilities going to be provided for unsheltered individuals, like a plan for refuse services and hand washing? Another question, is there a transitional location identified between the closure of the Sullivan Arena and when the Tudor and Elmer location will be made available? If so, who is the operator and what is the funding source? Also, will there be additional funds for outreach based on increased unsheltered individuals and expected inflow to unsheltered homelessness with transportation to better assist individuals with placement when openings occur? This current request is into the Assembly via member Rivera. So those were the questions that were posed and continue to be posed. And with that, I will turn it back over to the Executive Director. Thank you.
Thank you, Taria. So what I'm hoping is clear, and what we would have been conveying to the Assembly's Committee on Housing and Homelessness, is we're a real pinch point in the system. We have circumstances that haven't existed in our community in a really long time, if ever. And just to summarize what those circumstances are, is there is no shelter capacity, and there's, for single adults, there is no family capacity for shelter in this moment. And it appears that even transition-aged youth, 18 to 25, are struggling with the same capacity issues. So we have no capacity across our system. We continue to have significant inflow into the system, coupled with camp abatements, which just the first notices came out yesterday, official notices for 43 camps. So we really are at a point where we don't know what to tell people. So we need clarity from the local governing agent, entity, the municipality, to tell us what their plan is, because once we know the plan, we can more strategically engage with people experiencing homelessness. There's a lot of confusion and concern, and not having this clarity really gives us, not having clarity on how the government is going to either address these issues, or if it is going to address the issues, really puts it back on us, those who are interacting with people experiencing homelessness, to try to figure out solutions. We can put Band-Aids on issues right now, but we do not have the capacity or the resources to step in to meet the needs of over 200 unsheltered individuals currently in our community, the expectation of more, to ensure that they have hygiene, food, refuse services. And so that is why we're kind of raising this up, elevating these issues to the community, so you all know exactly the lay of the land. Hopefully we can continue to get additional answers to our questions. Again, if camps are being abated, what is the shelter capacity? Maybe the municipality is aware of something we are not aware of. We are asking all of the providers about their capacity. We are in close contact. So with that, I think it's really important that message be out to the community. We are working on it. We are working on it very hard, very diligently. We are working very hard. But also we should have a lot of grace for the people who are experiencing homelessness, who are put in a very untenable position right now, and the service providers who have been doing incredible work throughout the pandemic and are now having to deal with this very difficult situation. It is very difficult as service providers to tell folks that there is nowhere for someone to go. With that, I believe we have a faith leader who's joined us today. If so, can you see her on the participants and invite her to unmute? And we can stop the screen share, I believe, for now.
Yes, I am not seeing Dawn on the list. If they are in the participants list, could they just raise their hand with the reactions tool? Because I am not seeing their name.
Okay, so let's do this. If we see that person join us, we'll hear from them. If not, we're going to go ahead and turn to questions, and I will turn that back over to Owen and Sasha to handle.
Thank you for all your comments in the chat. At this time, we are not answering questions from community members and providers. While we understand there are a lot of questions, I am available to chat with you on the phone or by email later today or this week, and I connect you with some answers to your questions as best I can. We will take questions from the press, so if you have a question and you are representing a news organization, please use the reaction button to raise your hand. And Sasha, if you can see the order of people raising hands, that's helpful. And we will unmute you. And if you're having trouble with that, you can also put your name, organization, and question in the chat, and I'm happy to read it out.
I am not seeing any raised hands, but if you're having trouble with the raised hand, oh, I see there's one. You can also, if you are with the press, you can also put a comment in the chat box if that's easier. I see Lauren Maxwell. I'm going to allow your camera and unmute you.
Okay, I think that should, can you hear me? Hi, can you guys hear me? I guess I'm trying to get a better handle on the numbers because we talked about so many different ones. You said right now currently at the Sullivan there are what, about 200 people? Is that what it was? I'm trying to figure out 219 is what we talked about. How many of those people are quote unquote unaccounted for that you know in your sense will not have a place to go? You said some of these some people have already been screened to go into specific housing situations. Are some of the 200 that we mentioned people that are, you know, going to be put into housing, or are these all people that will just be kind of out the door when it comes to the end of the month?
Sure. That's a great question. So we've identified a number of individuals who are still at the Sullivan Arena who are on a housing path using emergency housing vouchers, some who are working through a permanent supportive housing program application process. We are hoping to be able to keep track of those folks through that process because it's not overnight. So a lot of those folks will eventually move from the Sullivan Arena into those non-congregate capacity spaces we talked about. So we believe between that and the referrals to complex care, and as those work through by the end of the month, the difference to be approximately 95 individuals. We haven't identified somewhere for them to go.
Okay, and in addition, though, you were saying that there's people that have been turned away for the last month at the Sullivan Arena who presumably might not have had a place to go as well.
Correct. Our best estimates of the number of individuals who are unsheltered in the community already are 200. I mean, it's an estimate. It's hard to get a very accurate count on that. We can, you know, attempt to do like a point in time count, but it's, you know, we have to see folks in order to know they're out there. So my best estimate right now, based on what I know and what we're hearing from our outreach folks in the community, is that by July, we're going to be hovering really close to that 300 number of people experiencing homelessness that are unsheltered, and that is single adults. We haven't separately accounted for families or transition-aged youth.
May I ask one more question before I sign off, since I have the mic? What would you envision as the perfect scenario when it comes to some sort of a temporary shelter? Or are you in favor of, you know, sort of structured campsites? Do you have anything in mind that you think would work, or that you've heard that people are working on?
So we haven't heard of anything that people are working on. In an ideal situation, we would want open communication, sharing of information, and collaboration with the municipality. Ultimately, they will set the policy as to what their response is going to be, if there's going to be a response. The homeless prevention response system is not in a position to pick up the capacity without a plan, funding, and resources. So, right now it's all about communication and coordination, and we just haven't seen that to date.
Thank you.
Thank you, Lauren. We'll next go to Emily with the Anchorage Daily News. Emily, you should be able to unmute yourself now.
Hi. So I believe you just said you're not sure how many families are currently experiencing homelessness, but could you talk a little bit about that and how that's different from previous years, why we might be seeing that right now, and then ideally what needs to happen to get resources to those individuals?
Sure. So I'm going to talk a little bit about the outreach, like kind of how we've traditionally done outreach, and then I'm going to turn it over to Taria to talk about maybe the why. So our outreach is always targeted single adults that the coalition coordinates, and then I know Covenant House has a very robust outreach program that targets youth and transition-aged youth. We have typically had a really streamlined referral process for families once they call 211 or they connect with a family shelter. The services, or they're identified through school-based services around their kids, the system kind of comes around them and takes care of them because there's been capacity in the system to do that. This is one of those times now, if a family calls 211 or a family shelter or those services, we don't have anywhere to turn them, and meaning that they're going to remain unsheltered because we don't have a resolution ready for them. And with that, I'm going to mute so Taria can talk about the why we might be seeing this uptick. And I would encourage anyone who is wanting to learn more about the current state of families to reach out to family providers and to speak to them. They're on the front lines of this. Our intersection with that is we convene these providers so we can share a little bit of the context we have, but to get the real information, the real story about and the complexities of families experiencing homelessness, I really encourage you to reach out to those family providers. Taria?
Yes, this is a great question because we did have this come up recently. And why are we seeing such an increase number in families? So we talked to a couple of family shelter providers, and here were their answers. Income, where they're seeing intakes into the shelter. Of course, these are not those that are unsheltered. These are people that are coming into shelter. Income related, loss of income, loss of employment, not getting public assistance. They were placed into housing at one point. They had no income and then still didn't have any income after the resources were gone. So they went back into homelessness. Evictions, not following program requirements. Therefore, they were exited or discharged from the program and then did not have the resources to continue into their housing plan. And there is a lack of things that case managers can do. We talk about client choice. Clients make choices. Case managers try to build a plan and lead and direct the best that they can. But clients are, especially in families, they are adults and make their own choices. Housing, of course, is a barrier as far as like with criminal history or even past evictions, especially recent evictions. Those are definitely a barrier into getting into more housing. And complex issues, that you have to address all of these things at one time to get them into that one unit. That is not going to be something that a family may be able to fix themselves. It might take some financial resources that they don't have at that time. So those are some of the reasons that they talked about in that family shelter meeting. The other thing they said, if we're talking about a solution, longer term funding for more case management and just funding for, case management or flexible funding to assist with like fixing a car or childcare, obtaining, that driver's license. All of those things are things that can help them to be able to provide additional services. So I hope that answers the question, but do feel free to reach out to those providers.
Is it okay if I ask one more question while I have the mic here? The individuals who are currently unsheltered, what kind of challenges are they facing right now, just in terms of, I know there's lots of people camping around Anchorage, and there's currently a burn ban in place. how is that impacting them, and also, public safety in the city? And also, do you have any idea of how many people have tried to access shelter since the Sullivan Arena stopped taking in new clients?
Thanks for the question. Before I answer it, we have a request to stop the screen share, and I think that's fine. If you could stop that, thank you. So with regard to your question, I think the challenges are, as we have asked the questions and how we're going to meet the needs, that those challenges are identified there. Food, water, it was extremely hot earlier. It seems to have maybe tapered off, but we expect more hot weather this summer. So staying hydrated, out of the sun. Additionally, food is a key. It's essential for survival. With the burn ban in place, a lot of the food we distribute in our outreach efforts at least require hot water or the ability to be heated. And so we're in this position where we're trying to figure out ways to get nutrition to people experiencing unsheltered homelessness. The food kitchens that are available, there's one downtown, which is quite a ways from where a lot of people are located. And then there are a few others around town, but there's no centralized way to get food to people who are experiencing unsheltered homelessness. And we can't give them the typical things we usually give them because we don't want them to start cooking fires in a burn ban because they don't necessarily have the equipment that would be allowing them to make an authorized fire. So we continue to work with partners. We've worked some with the Food Bank of Alaska. We're trying to work a partnership with the restaurant program. We've had a couple of offers from our food service providers in the community who do provide food to people experiencing homelessness, but we don't have the funding to do that. So this is again where we're asking the municipality, what are you going to do? Because you're in the driver's seat here. We're asking you for a policy choice. Do you plan to provide food to those experiencing unsheltered homelessness because of the combination of circumstances or not? And then once we know that, we can more strategically intersect with that decision and see what we can do and how we can leverage those decisions. For example, if we know there are food distribution points, we can attach outreach workers and case managers there so we can ensure we're connecting people. We can connect potentially hygiene services, mobile showers, we can have hand washing stations, we can have hygiene kits. But it's that coordination of what's going to happen, or if anything, and then what we can, add on to it, because we can't replace what has been in place, which is the access to food and hygiene for hundreds of people at the Sullivan Arena.
I
And that-
believe
the
there's
last-
one more.
Thanks.
Oh, go ahead.
Wesley from Alaska Public Media, I see your hand is up, and you should be able to unmute yourself now.
Hi, can you hear me? Are you able to hear me?
Wesley, you're unmuted, but the audio is almost inaudible. So if you can put your question in the chat, I can read it out, or if you can change your audio setting, or maybe your microphone setting.
While we're waiting on that, Owen, I see there was, I believe, question in the chat. Do you want to turn to that and we can see
Yeah.
if Mr. Early can resolve the audio issue?
I'm going to read out a question from Mike Ross from Channel 2. Should the Muni suspend camp abatement until a larger shelter is ready? And Meg, I don't know if you want to answer that.
So I think that I'm going to refine the question a little bit, which is we need to know if camp abatement is officially continuing, and then if so, what shelter capacity is being relied upon. Because it's been our understanding and the municipal practice that camp abatement only happens when there is adequate access to shelter available for those who are in the camps that are to be abated. And so we are unaware of any adequate shelter capacity to justify the abatement of camps right now. So I think we have some missing information, or if camp abatements are going to continue and there is no shelter capacity, then we need to know that so we can evaluate that position. I think it's extremely disruptive to abate camps when there is nowhere for people to go, because then not only are you shuffling individuals around our community, but they also have no access to services. So that just delays and disrupts the homeless prevention response system's efforts to house and meet those individuals' needs. So in some ways, the answer to your question is yes, but I don't want to say until a larger shelter is ready. What I want to say is camp abatement should be suspended until there's a strategy in place to meet the needs of those who are currently unsheltered. And again, we need that clarity from the municipality about how they plan to proceed with camp abatement.
Wesley, were you able to? Oh, Wesley said that Mike asked my abatement question. With the long period between the closure of the Sullivan and opening of the Navigation Center, which has a smaller capacity of 150, how concerned are you that there will even be capacity for those needing shelter once the Navigation Center is up?
Thanks for that question. I think we have a lot of missing information to be able to determine if there would be adequate capacity there. If we can figure out a way to move through this transitionary period where we can meet people's needs, ensure that there are places that we can stand up case management, continue to engage with individuals experiencing homelessness, we will continue our housing efforts very robustly. It is when people are dispersed into our community and are worried that they're going to have to move every 10 days that we can't keep those housing efforts up in the way that makes sense. It is an extreme drain on resources for those who are trying to connect with individuals experiencing homelessness. Instead of focusing on housing, we are focused on safety and immediate need. So hopefully we can find a plan between the June 30th and the time that another resource is available that allows us to continue the focus on housing. And that's going to require a few things. Clear communication about what's coming so the homeless prevention response system can plan strategically and hopefully leverage that plan to meeting the needs of people experiencing homelessness. Two, that we're meeting the basic needs of those who are both going to go without shelter and who are inflowing into the system. Because when we can meet basic needs, we can start to talk about housing. But housing is really not a conversation you're going to have if basic needs are not met. And three, we really need there to be, in some ways, a big deep breath in the system right now. It feels very chaotic. There needs to be some grace provided to those who are experiencing homelessness, who are currently unsheltered and coming into the system, because some of them are a victim of circumstances not of their own making in this moment. They were engaged in housing, and they were at the Sullivan, and now they are not able to be there. And acknowledging that the community as well needs to acknowledge that, and that we need to acknowledge the stress it places on the community, and really just keep an open dialogue so that we're trying to mitigate the impacts while also meeting the need. And that's a very challenging thing to do. So I would hope that we can keep open, clear communication and just take a beat when something happens so that we make sure we're reacting in a strategic way that meets hopefully everyone's needs and aren't reactive and placing blame in a very difficult situation.
Wesley has a follow-up, which is, have you gotten a good date for when the MOA anticipates the Navigation Center being available to houseless people?
That's a good question, and one that should really be answered by the municipality. So I hope that you reach out to them for that answer.
And Emily from ADN, you still have your hand up. Do you have another question? Okay, Emily's put her hand down. Again, for members of the public or other service providers, please reach out to me with your questions. And I will put my email in the chat again. Thank you everyone for coming today. Oh,
Actually,
here's Emily's question. It's in the chat. Do you have an estimate of how many people have tried to access shelter at the Sullivan and have been turned away since June 1st?
Thanks for that question, Emily. The provider 99+1 has reported approximately 100 people. I would recommend that you try to reach out to them for specifics about that. I don't know if that's an unduplicated number or 100 attempts to seek shelter at the Sullivan, but that is kind of just the baseline information I have. And then I don't know if you see it on Lauren
Yeah.
Maxwell's hand.
Lauren from Channel 2, please unmute yourself. Thank you.
I just had a real quick question, and that is when you sent those policy questions over, what, a week or two ago, did you have any response whatsoever?
Thank you. Not directly to the questions. I got some information. I finally got a copy of the situation report, the SITREP document, which I hadn't received previously from the municipality. I'd received it from the media, but no, we don't have official responses to those questions, particularly around camp abatement, plans for family, and then plans for food, water, and hygiene.
So they responded to you, but not to your satisfaction, basically.
Not to the questions asked that we think we need resolution to so that we can do the work that we do most strategically.
Thank you.
Thank you again to everyone for coming today. I want to reiterate, this is an update that we give monthly to the Assembly Committee on Housing and Homelessness, and is an update that we've offered to the committee for over a year, as we understand that their coordination with the homeless prevention and response system is vital to making good policy decisions. And I will provide slides to folks who would like the numbers that Taria has so carefully crafted for us all. Thanks again, and have a beautiful afternoon. Lauren, I will also email them to you. Aurora, can you put your email in the chat? I don't think I have it.